Hi everyone, welcome back to the channel. My name is Sue and this is Jimmy. Hi Jimmy. Jimmy's in all my videos because I think most people tune in for him and certainly not me, and that's fine. Whatever gets someone to this channel, I'll take. The name of my channel is Aliens Love Animals, and I came up with that title because I truly feel like I'm an alien on this planet. Not much makes sense to me. I don't understand humans at all, and I love animals. So most of my videos are about animal-related topics, whether it's rescue or vet medicine or something, and something totally unrelated to vet medicine. It's a little bit of everything. My background is I'm a vet tech. I've worked anywhere from a large university to some real horrible crap holes to everything in between. So I feel like what I have to say, I'm not talking out of my ass. I'm not a veterinarian. I don't pretend to be. I hate vet techs who think they are. I just am stating my opinion and hopefully spreading some information that might help pet owners. Today I want to talk about something that I get asked a lot, if not the number one question is, how do I find a good vet? Or how do I know if my vet is good? Or do you know of any good vets? It's such a hard question to answer because my answer is very disappointing to people and also maybe kind of confusing. And my answer to them is you really don't know if your vet is good unless you work with them. And I know that's not a practical solution or a practical answer because you can't all work as a technician or receptionist in a vet clinic to know if your vet is good. But unfortunately, that really is the only way. So now what? Well, what I wanted to touch on was some either red flags that show that the vet might not be very good, or some really beautiful flags that means that they're, high quality. I don't mean this video to be a bashing of the vet profession. I love this profession. I loved it when I was in it. There are some amazing, dedicated, unbelievable people out there in this profession, both vet techs and veterinarians. Most of them are amazing. But let's face it, there's clunkers out there, and I hope with this video to help you avoid those clunkers. That's really it. And I also don't pretend to be perfect, which is one of the things on my list here about admitting when you're wrong. But I'll get to that in a second. So the first thing that I want to tell people is pay attention to the exam. When you're in the room, now granted, I know what I'm looking for because I've been trained. I do exam myself, but there are some obvious things you can look for that give you an indication of how thorough your vet is. Number one, when an exam is done, it should be from head to toe and everything in between. That should be obvious, but in my experience in the last couple of years, for some reason in the area that I moved to, I can't find a vet to do a thorough exam. Like for instance, if Jimmy has an ear problem, I go to a vet and all they do is look at the ear. Well, I'm paying for an exam, and B, you might find something else that I didn't notice during that exam. So that's red flag number one, if they just address the problem you have and that's it. But to get back to the exam, what they should do is start from the head, look in the eyes, see if there's any discharge, the pupils are equal, if there's any cloudiness of the lenses, any discharge from the nose, open the mouth, look at the teeth, look at the gums, look not only superficially in the ears, but also deep to see if there's anything in the canals. That's really important. Lymph node, feel if there's any enlargement. Look at the nails, are they overgrown? Are they broken? Look at the feet, the pads. Look for external parasites or evidence of external parasites. You want to palpate the abdomen. In little dogs, it's important to test their patellas and make sure they're not luxating. And in older dogs, especially in the older male dogs, they should be doing a rectal exam to check for prostate issues. I am incredibly sensitive to that because my dog a male dog died of prostate cancer, and it was missed by many vets. And even one in particular, it was on her list of differentials about what might have been wrong with him. So she did suspect prostate cancer, but still didn't check his prostate. So don't get me going on that. And the other thing with an exam, and this is, I think, my biggest pet peeve, is when they're listening to the heart and lungs, especially at the heart. I would say 90% of the vets I have gone to, while they're listening to the heart, they're trying to have a conversation with me while the stethoscope is in their ears. And I'm like, okay, I think you need to be quiet now because you're supposed to be listening to the heart. And again, I've had doctors miss obvious heart murmurs. And I knew they missed them because I knew for a fact my dog had a heart murmur from another vet who diagnosed it. So if your vet starts talking to you with the stethoscope in their ears, I don't know. That's kind of a huge red flag for me. So that's the exam portion. The other thing is once they do have an idea of maybe what's wrong, or I think there should be a list of options. I don't like cookbook medicine that they just have a standard response for everything. Every case is different. Every animal is different. And they need to recognize that. So if their plan A doesn't work, you should have a plan B and plan C ready for the owner to choose from. And I also don't think you should be judging that owner if they pick plan C, which maybe wasn't your favorite, but it fit their budget or whatever the case may be. Vets need to understand that not everything that's in a textbook is the way it is in real life. So, and I have found with new graduates, that tends to be a problem. They're very academically driven instead of just in real life. So make sure the vet does a great exam and they listen. And when they're listening, that means they'll have some options ready when you have some concerns. And speaking of listening, part of an exam is not only hands-on, but it's also taking a history, asking. This should be back and forth. Most people don't have conversations. Most people just say something, then wait for the other person to shut up so they can say something next. A good history is a back and forth. It's really listening with follow-up questions and also believing the owner. No one knows their pets better than the owner. So if the owner says something and it doesn't quite make sense to you, well, just listen a little bit and think about it and keep it in your head about when you're making your diagnosis, because what the owner has to say is really important, and don't dismiss them. And along those lines, I would say a not so great doctor they tend to dismiss owners who tend to do their own research and come to them with questions. And I know there's vets and vet techs who hate the Google doctors, but there's nothing wrong with going to your vet and saying, hey, I read about this. Have you heard about this? Should we try this? I had a vet once, I presented something to her and she had never heard of it. And then she researched it and called me and said, hey, I never heard of that. Thank you. Let's try it on your cat. That was a great vet. I loved her because she was open-minded. There was give and take. She didn't get defensive. That's a thumbs up for me if a vet is willing to listen. So we're at a great exam, give you options, don't get defensive if you have some information maybe they never heard of. And the other thing is how they treat their staff. I had a doctor once who was really good. She did a really good exam and she took a good history, but she treated her staff like crap. I could not go back there. I could not do it. I just couldn't. So if they treat their staff like crap, I don't know, maybe they might be a good doctor, but I don't know. Does it mean they have a temper? Does it mean they're taking it out on their staff, and do they take it out on the animals? I don't know. It's just not a good vibe. It's not a good look. And speaking of personality, I know many vets get good recommendations from people because they have great personalities or they're cute. And they're funny, and that's all wonderful, but they really should have the whole package. And That alone should not be the reason you think your vet is wonderful. I mean, of course, it's great if your vet makes you laugh, but make sure they're doing a good exam. And then along those same lines, I think it's critically important that the vet make some sort of connection with your pet, especially on the first visit. You know, pet them, look them in the eye, maybe get down on the floor with them, um, make some sort of effort to make a connection. Um, I think that's really important, and it tells me a lot about what's in their heart. Um, I have worked with some vets who, on the outside, were just great personalities and lovely and funny, and they treated the animals like crap because I saw what went on in the back room, um, and that's never left me. So, and those vets also never made the connection or made the effort to make a connection in the room with the animals. So that was another sign to look for. So, and on the kind of minor list, it's not really minor, but are they returning your phone calls in a timely manner? I had one vet, I had to wait a month before he got back to me. And then he got angry when I said, I'm frustrated, I didn't hear from you. And he turned me into the difficult client category. I'd say within 24 to 48 hours, especially if there's blood work involved, all vets, can't get to the phone right away. They're dealing with emergencies, but I think within 48 hours, or if you can't get back, have your receptionist call back. Make some sort of effort to get those results or some information back to the owner. And again, kind of a minor thing, but part of the whole package. If there's going to be a wait in the room or wherever you are, mainly when they put you in a room, they say someone will be right with you, and they're not, and then a half hour goes by, you're still sitting there. At least get someone to come in, pop their head in, and say, "Hey, I know you're waiting. We haven't forgotten about you. We have an emergency or whatever." That goes a long way. I went to a vet not that long ago. I was the first appointment of the afternoon, so they had a 2-hour lunch break. They weren't behind because they just got back from lunch. There was no one in the waiting room. And I was on time. In fact, I was early. They put me in the room, and 35 minutes later, I'm still waiting there. And while I was waiting, I heard them singing happy birthday to one of their employees and having cake, and they were laughing. Well, number one, don't do that on my time. And number two, you had 2 hours for your birthday party. You should have done it then. So I'm just venting here, but those little things go a long, long way. And also cleanliness. If they can't keep the exam room clean or the waiting room, and there's smells coming all the way out to the front of the office, I can't even imagine what it's like out back. So that is a red flag too. And also, don't be shy to ask, "Hey, can I have a tour? I know if there's surgery, I can't do it, but if there's any time I can come by and have a tour of the clinic." It can't hurt to ask, So that's my main list. It probably felt like I was rambling here, but it's really important to not just rely on personality. And again, I can't expect anyone to go work for a vet to really know what they're like, but I hope these little hints help you. And I should have put this on the list, but it just came to me, and you can tell I don't know how to edit, so I'm just like freebasing here. I don't know if that's even the correct term. I'm not doing drugs, whatever. Um, if an animal has surgery, I don't even care how minor it is. Maybe if it's tiny minor, like a little scrape, whatever. But if they don't offer pain medication or they don't have any pain management protocol, that's a big out for me. I worked with the shelter vet when I worked as a shelter vet, vet tech, and she never gave pain meds, or the pain meds she gave were kind of a joke. I don't know what her rationale was for that, but I hated working for her, and I still hate her. Give the dogs and cats pain meds, please, people. Come on. So anyways, that's my rant. I hope some of this was helpful. If anyone does see this, if you want to leave a comment, if I left something out, please let me know. If you think I'm bashing the profession and you want to, start yelling at me, that's okay. That's not what I'm doing. I worked as a vet tech at a veterinary teaching hospital in New England, and I worked with students. And there were some students that I swore would never graduate because they were so lazy and they were so no ethics and no skill, and they graduated. I think because mommy and daddy were paying their tuition in cash or something. That really bothered me. And so I just want to do my part to help you navigate through the clunkers out there. But remember, most of them, and Jimmy agrees, are awesome, and we thank you. And I miss the profession very much, and I am forever grateful for being part of it. Peace out.